Step 68, sperm factors. For optimization of your IVF treatment, you need to really understand what factors affect your sperm quality, quantity, and sperm function. And also, you should be able to analyze sperm quality, quantity, and function during IVF so that you can improve it for future cycles if necessary. The biggest factor for sperm production is the genetic factors, which is already predetermined before you are even born. Your overall health during your childhood and adult life is important. Provided you enjoy generally good health and you don't work in the environments with increased radiation or chemical pollution, if you have a healthy diet and you don't smoke heavily, then you don't need to worry too much about these factors. So then the 3 months preceding to IVF is important because it's when your sperm gets activated. The sperm we use in IVF were activated 3 months prior to IVF treatments. During this period of time, you should really try to minimize the harmful effect of any like smoking, any environmental factors. You should have a healthy diet, do plenty of exercise. You should try and stay as healthy as you can. Then sperm collection is important. Ideal time for abstinence is 2 to 3 days before you provide sperm for fertilization, which is 2 to 3 days before the egg collection. You shouldn't abstain too long because testis has got 2 different units, production unit and storage unit. So sperm can get stored in storage unit for a very long period of time. It can be subject to oxidative stress, and we may end up using those sperm for fertilization of the eggs. You should try and do frequent ejaculation leading up to egg collection, maybe ejaculation every couple of days to get rid of all sperm stored in storage unit. You need to really abstain 2 to 3 days before the egg collection, and you should try and produce sperm in the clinic premises, which will be of better quality than sperm you produce at home and brought to the clinic. Selection of right method for fertilization, IVF or ICSI, is important in terms of having good fertilization and embryo development. You can see there are a number of factors. Some of them you can impact, some of them you cannot. But you should do your best to have a healthy lifestyle and improve the sperm quality of sperm you provide on the day of egg collection. If you didn't have a very good cycle because of poor sperm parameters, you shouldn't get too upset because there is a natural variation in sperm quality, quantity, and function. So on that day, probably you might have had a very poor sperm production because of just natural variation. You hope that in the future cycles you have a better outcome. Of course, you should do everything you can to improve sperm quality, but again, maybe just it was so unlucky day that you didn't have a very good sperm sample on the day of egg collection. Now I will explain how you can assess sperm quality, quantity, and function. Sperm quality and quantity is assessed by semen analysis test. Generally, concentration of the sperm tells about the quantity of sperm you are producing currently, and the motility, vitality, and morphology tells about the quality of the sperm. But that's a morphological assessment. That means what we are seeing when we look from outside. Now we need to assess the function of the sperm. Sperm quality and quantity may be excellent, but the function may be poor, or vice versa. The function of the sperm is assessed by analyzing fertilization rate and utilization rate and implantation rate. Generally, let us say we see 3 different scenarios. Let us say your partner produced 10 mature eggs. You would expect that good quality, good functionally healthy sperm fertilize approximately 8 or 75% or more of mature eggs. This is one assessment, and the second assessment is a utilization rate, which means how many of those fertilized become high-grade blastocysts. You would expect approximately 30% of fertilized should become high-grade blastocysts. Yes, there could be the factors affecting egg due to egg quality, but generally, if egg quality is assessed to be normal, if you're losing the most of the embryos during activation of the sperm from day 4 to day 5, then you can assume there is a significant sperm element. Implantation or live birth rate should be approximately 35% per embryo, or here if you produce 3 high-grade blastocyst embryo, then you can assume 65% or more chance of having a child using from that cycle. If sperm function is average, then out of 10 you would fertilize 6 mature eggs, so 50 to 75% of eggs got fertilized. Then you would produce maybe 1 embryo, which is the 15 to 30% of fertilize, become a high-grade blastocyst. Here you would have only a 35% chance of having a child from that cycle. If sperm function is very poor, sperm can fertilize maybe less than 50% of or less, 50% or less mature eggs. Out of 10 mature eggs, you're getting 3 fertilized embryos, then none of them converted, less than 15% or non-converted to high-grade embryo, and that's why you have a 0 chance of success in that cycle. Sperm assessment of sperm quality, quantity, and the function is very important to understand where the success or failure of certain cycle is coming from, so that you can address that factor directly in future cycles and improve. In optimized IVF, you identify factors which is affecting sperm quality and trying to improve it so that in the future you start having better outcomes.